Thank you very much, and hello everyone. And my presentation gonna be based on global health and safety concerns amongst occupational drivers. This study was based on global materials, where I started to do an epidemiological review of relevant studies published in peer-reviewed journals, and conference proceeds have both together have shown the combined impact of multiple occupational risk factors and the possible adverse health effects on the commercial motor vehicle drivers. Um, as you may know, the majority of the government agents and safety professionals worldwide consider the health and well-being of commercial motor vehicle drivers as one of the biggest concerns. To do so, I put a plan to review and analyze the combined impacts of multiple occupational risk factors and the possible adverse health effects on CMV drivers. The first action, which is the first step, is to identify the major risk factors, like, for example, long hours of work, irregular schedule, poor diet, stress, sedative roles, and social problems, drink or drug risk. That's the first step. The second step is to link the identified risk factors to specific medical conditions, such as sleep disorders, hypertension, obesity, cancer, back pain, arthritis, stroke, diabetes, mental health issues like depression, respiratory, gastrointestinal, and cardiovascular diseases. Um, and the third part of the plan is to light on the wider impacts of the risk factors and the medical conditions on the society as a wide range of this effect. Like, for example, the cost to the health services. For example, in Canada, we have a free healthcare system. So, if the risk factors and the medical conditions will increase among CMV drivers, so it will cost a lot of money to the government. Uh, or in US, where there is no healthcare system, a free healthcare system, where the drivers has to have an insurance or has to pay for the services. So this could have a very negative impact on the drivers. The other thing is potential danger to other road users, like any drivers, not professional drivers, could be at risk having a professional driver sick on the road. Other impacts, for example, to the individuals and families, like divorce, breakups, breakdowns, potential for violence and the stress-induced issues, as most of the drivers could develop mental issues, depression, for example, and how the unlimited hours of work for drivers can limit the family time and the quality of time spending with the families. So that's why it could cause again to the divorce and breakups and all these family issues. Physical illness or even to death. Other thing, the financial consequences of ill health, like, for example, most of the employees or independent contractors have no coverage if they get sick. The method was used to identify all these issues related to the CMV drivers is conducting a literature review or search and review and analyze a range of relevant studies, and I can say even, or I can call it as an intercontinental review, where I collected studies from different countries, such as from Canada, US, Ireland, England, France, Asia. And the other thing is to explore and interpret the effects of multiple risk factors and related health issues, where it's pretty similar in each place. As a result, the major terms I identified or we've been discussing is nutrition, physical activities, smoking, substance use, stress, lifestyle, family, fatigue, workplace, and regulatory factors. In terms of nutrition, like most of the driver had no access to the healthy food on road. And the other thing, like difficulty to bring food from home, they are working in different hours. Could be early morning, could be at night, could be late night. And eating when driving to save their time because their time is money, they consider. So no time even to have some little relax and having their meals in relaxing atmosphere. Lack of healthy choices. So in some countries there is no options to um, to provide healthy options of in terms of foods and higher price of healthy options like in US in Canada for example the organic food or the healthy options of food is very expensive caring for high calories food so basically the drivers they prefer to have a fast food like with respect to all those companies like McDonald's, Burger King, pizza and all these things. In terms of physical activities, um, drivers having a sedative lifestyle, long days, and they develop fatigue as a result. Lack of motivation. The more you sit, the more you want to sit. And most of them have bad habits like smoking, drinking, or access to the pets. Restriction on movement at customers and pollution at customers. And smoking and other substances like illegal drugs. The smoking like helps with stress frustration. So most of the drivers prefer to smoke just for pastime, and they believe that they can calm down and relax, and help them to keep awake. And another substances besides the smoking is like energy drinks and stimulants use and weekend alcohol use. So smoking and the other substances helping the drivers in their belief to be awake, to spend more time at work, to make more money. The fatigue cause of like lack of sleep during long hours of work, and most of them they spend at least between 12 to 16 hours a day. Inconsistent hours, and in this way, sometimes they can work 16, 20 hours. Some drivers they sleep in the car, believing to get more business. Some drivers are starting at night and early morning and continue to the next morning. Um, and the regulation for downtime has not been helpful in this situation. And to keep them awake, like besides the smoking and other substances, they consume a lot of coffee. Uh, Besides these factors, um, the workplace and the regulatory factors, uh, because of drivers, they have only one workplace. This is a car. In a car, they have no access even to fresh air. They consume their food during work hours in a car, developing stress based on the communication with different people with different mentalities, um, and then cut off or isolation from the society. Even they are communicating with different people, but they are isolated in terms of families and friends because they don't have time to spend it in a quality way. Um, we try to use, as I mentioned above, different references and sources globally, just to identify the risks, common risks between the drivers, regardless of the locations. In conclusion, the poor health of commercial drivers
Excuse me,
is
Dr.
largely
Anthony.
as
Sorry for the interruption. Your time is running, so you please try to conclude the session in 1 minute of time. Thank you.
sure. Thank you. I'm sorry for that. The poor health of commercial drivers is largely as a result of demanding and transitory work environments that are not supportive for regular physical activities, good nutrition, quality sleep, and access to health information, regular or preventive health care. The links between drivers' health and demanding work schedule, lifestyle practices, and work-related injuries are well established. Given these linkages, interventions that address both health promotion and occupational health and safety are of utmost importance in the commercial driver population. Thank you for your attention.